Sparked in part by this case, Governor Glenn Youngkin and others are calling for mental and behavioral health reform. Here's the governor on Monday.
Just ask everybody to lift up his family in prayers. We also can just see the heart-wrenching nature of the challenges in our behavioral health system.
Now tonight, other local lawmakers are also sounding the alarm. 8 News reporter Sierra Krug joins us live with how they're working to help. So what's the holdup, Sierra?
Well, Deanna, Virginia's General Assembly has been at a stalemate in approving the state's budget, part of which includes Governor Glenn Youngkin's 3-year plan to approaching mental health crisis intervention. Now, that's something advocates say could make a huge difference in the way situations like what we saw with Otieno's death are handled. Following the death of 28-year-old Irvo Otieno, who was allegedly suffocated during a mental health crisis at Central State Hospital. Mental health advocacy groups and people across the community calling for reform. Virginia State Senator Cree Deeds gets emotional after the release of video showing Otieno's death. A decade ago, Deeds was stabbed multiple times by his son Gus after no hospital beds could be found for court-ordered mental health treatment.
This young man didn't have to die. And I'm just heartbroken about the whole situation.
This as Virginia's General Assembly reviews the state's budget, including $230 million towards improving the state's behavioral health system, a topic Governor Youngkin doubled down on earlier this week.
Heart-wrenching nature of the challenges in our behavioral health system, and why I think it is so important that we press forward with aggressive transformation of that system.
Otieno's family lighting fire under lawmakers, hopeful for more than just words.
Our governor, what you said about our family, if you really do empathize and you feel what we feel, do something.
Do something.
Let your state be an example.
Deeds underlined measures like bumping behavioral health workers' pay, increasing Medicaid reimbursement rates, learning to prevent mental health crisis rather than relying on response tactics.
Our complacency as to the suffering of others reveals a deeper problem in society and people, and we need to maybe do a better job of looking out for each other.
Youngkin's 6-pronged Right Help, Right Now plan also tackles school-based mental health instruction and mobile crisis team units. Now, Deeds also added that the discrepancy in being able to approve the budget comes from an inability for the different teams involved to decide which areas to focus on. For now, live in Chesterfield, Sierra Krug, 8 News.